Coming up.
We're going to talk about kind of like the more long-term effects if the torticollis isn't dealt with, if there's any connection with scoliosis of the spine, the crooked spine. And then we also want to talk about my baby had a release, but they're still reflexy as all heck.
Top of their head to the tips of their toes and everything in between, to make sure that we are setting them up with good alignment and symmetry for that foundation of movement, because we're setting the stage for how they're going to move pretty much for the rest of their life. Again, it's those asymmetrical forces on growing bodies, right? And so where the forces came from can be different from child to child. And, oftentimes there's spinal anomalies, right, in the actual vertebra, and that can cause scoliosis and issues in the spine. And then, like you said, if we look at the big picture, is there fascial tension? Is there muscle tension that affected growth? Because it's forces on the body. The fascia that tight fascia and tight muscles can create a different force on this side of the body versus this side of the body. So there's no way it's not connected, right?
We have a special offer for our Munch Bunch listeners. To book a virtual consult with Megan, she's offering a discount of $25 off. Just email her, Megan, at nwmyofunctionaltherapy.com or through her website, www.orofacial-myology.com. To book a virtual consult with Kimmy for the $25 off, email her mouthmusclememory@outlook.com or through the website, www.mouthmusclememory.com. Now on to the episode. Hi, everybody. Welcome to the Munch Bunch podcast. This is Kimmy Nishimoto and Megan Van Noy. And today we are back with our friend Britta DeStefano, or you might know her as Progress Through Play, PT.
Yay! She's back.
She's back. So if you listened to the previous episode, Dr. Britta talked to us about torticollis, which is kind of the banana-shaped baby body. Also talked about tension in the body and how she helps those little ones get more relaxed and aligned, which can help with other things, either pre, post frenectomy, or even if there is no tongue tie, some of these babies come out with tension or they develop tension later on. So if you haven't listened to that episode, go back, because today is part 2, where we're going to talk about kind of like the more long-term effects if the torticollis isn't dealt with, if there's any connection with scoliosis of the spine, the crooked spine. And then we also want to talk about my baby had a release, but they're still reflexy as all heck. So those are kind of the points that we're going to hit today. But before we start, Megan, will you pull our affirmator card?
I shall. All right, you guys. Oh, yeah, we didn't do this last time with you, Britta. So one of the big things that we are, these are our affirmators. I've had these for a couple of years, and I can't believe it took me so long to send them to Kimmy. I don't know what happened there. But so we've been pulling our daily cards, and then we pull episode cards. And just to kind of set the intention for the episode and kind of give people, a way to good start to set their Monday. So, all right, Britta, I will let you pick this one. Tell me when to stop.
Okay. Stop.
All right. Depth. All right. So depth is our card today, which actually seems also kind of fitting since we really are like taking things to the next level. So as new people show up in my life, I look for all the weird, wonderful, complex layers below their surface. I can't be surprised by someone's depth of character unless I'm willing to peel back the outer layers and go a little deeper. It's like the brand new saying goes, don't judge an onion by its haircut.
That's so perfect. We do need to dive below the surface for these babies.
Yes.
Especially like talking about fascia, how there's
Mhm.
like all the different layers of fascia, which I just learned about. I didn't know
Yes.
that. I
Mhm.
knew that there was like the one to the skin and around the muscles, but I didn't realize there's so many stinking layers to that fascia.
Well, and around all the organs, which is why it can have such an effect on like what you just said, our baby's digestion and comfort and GI issues and all of that.
Yeah. Yeah. Perfect. It's the perfect card for today. So, okay. So kind of where we left off last time, we had started talking about, what happens if torticollis goes untreated? What's the connection to scoliosis? What's the connection with tongue ties? So I don't know if you want to do like a little quick snippet of like the torticollis piece and then kind of dive into what happens if we don't do anything about it.
Yeah. So if we want to do a quick rewind about torticollis, traditionally congenital muscular torticollis is referring to a tight muscle in the neck, but we know that our muscles don't work in isolation. So typically if we have tightness in our neck, there is something else going on below that. It does not only affect the neck, it can affect range of motion of the rest of the body and movement more than just the way that their head and neck move. So when we're treating babies with torticollis, we make sure to, or we should be, if you have a knowledgeable provider, treating the entire body, from the top of their head to the tips of their toes and everything in between, to make sure that we are setting them up with good alignment and symmetry for that foundation of movement, because we're setting the stage for how they're going to move pretty much for the rest of their life. We all have, habits that we've gotten throughout our lives. And so we don't want to set them up with quote unquote like bad habits from the get-go. We want them to have the best opportunity to move in all ways that feels good. So this is what I say when I'm working with babies is I want them to feel good in their bodies and be able to move well. And if things like torticollis go untreated, we're setting them up for potential, being prone to injury or having pain. Asymmetrical movements put asymmetrical forces on a growing body. So it can have these long-term effects on how their body functions.
Yeah, love it.
Hopefully
Perfect.
that makes sense. That's kind of an overview.
It was the perfect recap. I love it. I love it. Then yeah, so what does that mean for if we don't do anything, or if the orthopediatrician, is like, oh, it's fine, we'll just wait and see, which is my least favorite phrase known to man. Wait and see, or I guess number 2 phrase is, oh, it's fine, they'll grow out of it.
Yeah. So my biggest point to make in that, or hearing that, is that if we notice something that may not be optimal about the way that our baby is functioning, and we have an opportunity to help that thing, whatever it may be, become more optimal. If we have that chance, we have that opportunity, why not? Why wouldn't we give that opportunity to our children? Mm-hmm. So sometimes it flies under the radar and nobody notices. And so we don't have that opportunity maybe early on. And then it comes to light down the road and we work on it when it becomes a priority or when it gets noticed. And no shame or judgment when that does happen, because oftentimes there are just other things that are our priority and we don't know what we don't know. Right. But if we notice it, in what universe would you not want to give your baby that opportunity for optimal functioning? Mm-hmm. So, the wait and see or, oh, they'll grow out of it are 2 of my kind of biggest pet peeves, because I see the amazing results when we get started early.
Yeah.
in those first few months of life, our babies are so adaptable and are learning and growing so quickly that we have these opportunities to really set that foundation before, they start achieving these milestones asymmetrically. And then we're needing to help them like relearn movement patterns that they've already kind of ingrained in their brains and bodies. And that's harder. It's harder to relearn something in a different way than to just be able to do it optimally the first time we learn it. It's not impossible. We do it all the time as physical therapists. We are reteaching movement, but it's quicker results the earlier we start. And that foundation for symmetrical movement is it's so important for just everything that they'll learn down the road.
And I think a lot of parents, it's hard because of budget stuff, right? Like, for physical therapy for a baby, is insurance generally accepted, or is it something that they have to pay for out of pocket? Like, how does that work?
There's a lot of different options. And, unfortunately, in some areas, there may not be as many resources as others. What is always available is the state early intervention programs that may be run by county, or, it's different in each area. But that's a federally mandated program that every state has to offer. And it's either free or sliding scale, or they will bill insurance. But it is the most, kind of cost-effective way if your child can qualify for their services to get physical therapy. There's clinics that bill insurance. There's out-of-pocket cash pay therapists like myself. So there's multiple options there. And, if families aren't sure where to start, going to their state's early intervention website, you can self-refer. You don't need your doctor to send you over, or a referral or a script or anything to refer yourself to that state early intervention program. So you just, I think it's also on the CDC website, but if you just Google early intervention and your state, their website will come up, and they are a great place to start.
Thank you so much. That's really helpful.
So helpful.
And if they don't go through the state, do they have to normally like go through the pediatrician or the IBCLC to see a physical therapist?
Most states have direct access for physical therapy, or some degree of it. Again, that kind of varies state to state, but like in Colorado, we have complete direct access. So they do not have to go through any other provider in order to come see a physical therapist. So they can start with me right away with no red tape or anything that they need to go through in order to start services.
Which is huge.
Yeah.
Okay. So let's talk about, say a parent is in that position where baby is very tense, they're kind of uncomfortable in their bodies, they're doing that banana shape, the C-shaped body, head turning preference, but one, they maybe didn't know that was a thing, or two, they couldn't afford it and they were like, it's fine, like we can get through it. What are some of the long-term effects of that torticollis going untreated as they start to grow in the next couple months and by the first year?
Well, you'll notice that their motor skills will usually be very one-sided or asymmetrical. Everybody can probably picture the crawling pattern where babies like to just have like one leg up kind of funny, and it looks like that one-sided crawl. They start pulling to stand only with one leg, only using one leg to go up and down the stairs, and just having this significant preference for using one side of their body more than the other. That causes a big imbalance in strength, and then puts more forces through that one side. And it's almost like an overuse type situation. If you think about them continuously always using one side more than the other from such an early age, athletes who use one side more than the other get overuse injuries, but this is a baby using one side of their body for everything they do just from, kind of day one. So not to scare people and say that, if the torticollis didn't get treated right away, then that means they're automatically going to have X, Y, and Z issues. But we can see things kind of develop down the road as an impact of an untreated torticollis. So that may be, asymmetrical forces on the jaw, which you guys probably see a lot of in terms of the repercussions of that. But what I see a lot of too is the pelvis and asymmetrical forces through the pelvis, because like I mentioned before, it's not just that one tight muscle in the neck. It usually goes all the way down through the trunk and into the pelvis in terms of tightness and the pelvis kind of getting stuck in one motion and not being able to move fully. And that's where I see a lot of the problems arising from, is through that tightness down into the pelvis. Of course, obviously the neck and jaw and everything as well. But I always like to look big picture and make sure that we're not just looking at one piece of the puzzle, but that whole big puzzle and all the pieces. And it's a lot of connecting the dots, but that's one big piece that I always want to make sure that, we address, and that doesn't kind of fly under the radar, because the pelvis is such a important thing in our bodies for movement, for its attachment to all the muscles in the pelvic floor also. And we talk about the pelvic floor connection with oral function. And we could just go into so many rabbit holes here. But again, it all kind of comes back to looking big picture, connecting the puzzle pieces, and just making sure that we do as much as we can to set that kind of symmetrical foundation.
We want to introduce the spot for Tots Course, a parent's guide for toddlers ages 2 to 5 for mini Myo. We have Megan and Kimmy going over nasal hygiene, myofunctional exercises, breathing exercises, tongue-tie healing protocols, and then we have Jenny June going over sleep hygiene, and Kelsey Baker going over feeding therapy and body work. The course is $297, and the link will be in the description.
Yeah, we recorded a podcast with the Gillespie approach with the cranial fascial therapy. And they were teaching us that there's such a strong connection between the back of the head, the occiput, and the sacrum, which is like attached to your pelvis, which makes sense. You hear about cranial sacral, but literally that's your spine. So like, no doy, but sometimes we just kind of like forget about it. We're like, I don't know, I'm just tense here. But of course that would affect everything else because of the muscles, but also through the fascial system, and that affects the spine.
Absolutely. And forces translate. Like if there's a certain force going through one part of your body, it translates through the rest of your body. The same, like if you're walking and the force from the ground, it doesn't just hit your feet, it translates all the way up your body. So people who have asymmetries in their gait, it will affect things all the way, what we call up the chain in physical therapy of it is a chain. Everything is connected. And so if we have asymmetrical forces, at the top in jaw, neck, that's going to translate down, and vice versa. It's going to translate up the chain as well. So it can be kind of overwhelming sometimes, though, to think about all the puzzle pieces. And that's why kind of finding the right providers who can support parents in understanding. A lot of times I'm not the only one that needs to be a part of this, treating the whole chain and the whole body approach. And, sometimes I get a baby in for an evaluation and I say, wow, there's a lot of things to address here. I can't be the only one addressing all of this. Here's who we need to pull in to help make sure that I'm not missing any of the pieces. And sometimes it's things that maybe I do have expertise in, but I find a priority elsewhere and say, you know what, we're going to have OT focus on this piece so that I can really focus in on this piece. Or we're going to, pull in the osteopath or the craniosacral, or there's so many. And for each family and each kid, that's a big piece of it, is finding the right team.
Gosh,
and it looks different for every family.
Yeah. And finding the right team, I think, is honestly the biggest barriers for families. Knowing who they should go to, knowing who they can trust, knowing who actually, is aligned with them and can really help them. Because how many stories have we all heard about? Well, we've gone to 3 other lactation specialists, or we've gone to, the pediatrician and this person. And, you guys know my story. In the hospital, they blew me off about Isabel being tongue-tied. And, her pediatrician was like, yeah, I don't really think it's impacting her. It's like she gags and has blisters all over her lips. Right. And, I always say I'm really lucky because I knew this stuff, and I, didn't really care what anybody else told me, because I already knew. Right. But, how many times do we end up in those spaces where it's like, you don't always know who to trust. Why wouldn't you trust the pediatrician? And I'm not saying there's anything wrong with pediatricians. It's just not their special space. Right.
Yeah.
And so I think it's so hard to find the right team and the right people. And I don't even know that every city has the right team and people.
Yeah. I mean, we were just talking about it. I'm having the hardest time right now with my own child because I'm such in the infant space. My kid is 8.5, and my expertise do not translate to oral function and being able to treat my 8-year-old myself. And I feel for parents, because I was in that spot 8 years ago and unfortunately didn't find the right providers at the time. Their resources just weren't as readily available as they are now. And that's kind of why we're in this spot currently, while I'm still searching for the right people for him. But I think the more we disseminate this information through podcasts and our social media and all of it, I mean, my Instagram reel that has the most views of any of my content that I've ever made is just about the signs that I missed in my own kid and what I wish I had known, but just his lip blisters, his milk tongue, his tension, his, feeding difficulties, and all the things that nobody connected the dots for me, but it resonated with so many people. And I got so many comments on it, and it got shared so many times because people are literally just looking for someone to validate their experience and be like, yes, I hear you. I understand. This is not normal. It's common. People normalize it, but our babies are trying to tell us something they can't communicate, but there are signs if you find the people who know what to look for and can really listen and validate and support the families. And so I could just tell from the response to that reel how many people are craving that validation and someone to say like, yes, there is support and resources to help with this. So,
and also it's a thing, and it's not supposed to be as hard as it is right now.
It's not just in your head.
Yeah. I had a 34-year-old patient yesterday who's been really struggling with her ears over the years, and has always been made to be a little bit crazy and, kind of hysteric and, kind of just blown off. And so she's kind of taken this journey upon herself. And basically she was like, well, I just kind of was thinking I would, I know that I can't quite find the right people, but I've been doing my own research. And so I've just been kind of thinking these providers, I'm just kind of using as tools to get to me where I need to be. And she was like, I'm so happy I found you. because now I'm like, nothing's ever crazy here. You know, like I've heard it all, I've seen it all. You'd be surprised. And as I was making those connection pieces for her, you know, she cried because she was like, I can't believe, you know, that like this is it and I'm not crazy, and that like you're completely validating me where I'm at. And I'm like, you just haven't found your people. And you know, it's like,
was it TMJ?
Yeah, TMJ, migraines, ear pain,
Tongue thrust.
Yeah, yeah. She had a with the beads. What was that? Like a tongue tamer with the beads when she was like younger, right? And all of it, you know. And so, and that happened to me a few months ago too, with another gal who was like, I need to kind of process the emotional pieces of this because nobody's ever been able to explain these things to me before.
There's quite a bit of medical gaslighting that happens too.
Yeah. Especially for females. Especially
and that emotional release happens often in my practice too, where the parents are just like, thank goodness someone is connecting these dots for me finally, that I'm not crazy, that it doesn't have to be like this way forever. So I think that's really a powerful part of what we get to do. And it's really cool. I mean, I don't like making people cry, but I think it's
they're tears of relief and joy and understanding, right? Like they're tears of like, oh, finally, like I found my people. Because like even when I was attempting to breastfeed Isabel, you know, the worst chompy latch. Oh my gosh, she made me cry. And my mom was, you know, God bless my mother. My mother's a saint, and I will never say differently. But she was like, well, it's kind of supposed to hurt a little bit at first, and then you just get used to it. And I'm like, no, Mom, no, it's not. It's not supposed to hurt. And she's like, what do you mean? I'm like, it's not supposed to. I know I haven't done this before like you have 4 times, but I know it's not supposed to hurt. You know, and she's like,
also, your mom had all tongue-tied kids too, so that is her experience.
Yeah, you know, she's like, you just kind of like toughen up after a bit. And I'm like, you're tougher than I am, Mom. You had 4 babies.
Well,
you know?
But that's the thing too, you know, you're talking about like the 30-year-olds coming to you and finally getting that validation is like, it's never too late. So when we're talking about like, yes, the long-term effects of these asymmetries in the body, it's never too late to address them. And the techniques that I use work all for literally any age, infants to adults. I can use them on myself. I have my own kind of fascial tension patterns. I'm tongue-tied as well. So like I have some asymmetries that I can work through using the same techniques I use for babies. And so I often have parents, when they're trying to understand what we're working on and how we're addressing it, do it on their own bodies so that they can feel what that feels like. And all of us can probably find something asymmetrical in our bodies when it comes to movement. Maybe I can lift this arm up better than I can lift this arm, or I can twist a little bit more this way than I can twist that way. Right. You can notice it, say, in your workouts or in your movement, or my neck always, you know, hurts on this side versus that side. And we don't want our babies, when they're brand new, to have to be feeling that way, right? Where they feel like they're restricted, where some movement just doesn't feel good to them. And babies will always choose the path of least resistance when it comes to movement. As adults, we can kind of push through stuff that doesn't feel great. If we know like, oh, I really need to strengthen my weaker side, I'm going to like make sure and do more on that side in my workout, because we have that frontal lobe developed that tells us, you know, to kind of override those base instincts of like, something doesn't feel good, I'm not going to do it. And honestly, we should probably listen a little bit more to some of those and make sure we can make the movement feel good first, and then work on, you know, strengthening our weaker sides. And that's my approach with babies is I don't want to force them to strengthen or move in a direction that doesn't feel good. Instead, I want to work on making the motion feel good first and then ask them to move that way so we can strengthen them symmetrically. And I think that's different than maybe the traditional approach to treating torticollis and what I was taught out of school initially. And my approach has absolutely changed over the 11-ish years. I don't remember how long I've been treating now, but it's completely different than how I was initially treating torticollis. And I think it's really evident in how quickly families can see results because you're working with the child's body and not against it. And it feels better for the parents. And then they do more of it at home because it feels good. And so the carryover is better and the results are quicker.
Very good point. So when we're talking about the tensions and stuff, like what is the connection between torticollis and scoliosis where the spine is twisted or you get that like the spinal cord can, or the spinal column can get a little bit like crooked or twisty or turned?
Well, yeah, like my best friend has a tongue tie and she has scoliosis and one of her shoulders is a little higher than the other. One shoulder blade sticks out a little bit more than the other. And we've actually talked about this a lot. And I know she's going to listen to this episode because she's our number one fan. Hi, Hannah. We've talked about this a lot. And this is a big question that we've kind of been throwing around for a while because she's that hallmark tongue tied. She has scoliosis. She gets migraines, and so I've always been really curious.
Yeah. And I don't think there's enough research out there on all of how all of it's connected because we notice as providers these associated conditions, right? I'm screening all of my torticollis kids for tongue tie, which I was not doing at the beginning of my career. But again, it's those asymmetrical forces on growing bodies, right? And so where the forces came from can be different from child to child. And, oftentimes there's spinal anomalies, right, in the actual vertebra, and that can cause scoliosis and issues in the spine. And then, like you said, if we look at the big picture, is there fascial tension? Is there muscle tension that affected growth? Because it's forces on the body. The fascia that tight fascia and tight muscles can create a different force on this side of the body versus this side of the body. So there's no way it's not connected, right?
Yeah.
But it's hard to rewind all the way back if you're looking at an adult per se,
right?
And know 100% that X, Y, and Z, this is like what happened. But it makes sense in my mind, right? When we start to see how this part of the body is connected to this part of the body, it is all a big, puzzle, and all those pieces are connected.
Yeah. It's so cool. And I don't even know how you would start to even research those pieces, but it's one of the weirdest things for me now that I'm, a decade into looking at like this body space, like how we still have people out there and practitioners out there who don't talk about how the whole body is connected. And I get that we study those systems differently in medical school. And I get that that's kind of how our medical system is set up, but it still surprises me, like, especially kind of in this like day and age that we are I think we're starting to move, or at least my world is starting so much more holistic. That is like, you say these things and you're like, yeah, duh, the whole body's connected. But like, how many years have we like had to relearn that?
Yeah. I know. I think it went into this, super specialized, everyone's like really in a niche, treatment area. And now we're coming back to, and I still think that's really important to like have your expertise. And I have really narrowed down my patient population and my specialties, but having an understanding of the big picture. So even if I am treating the whole body, but even if there's a piece of the puzzle that is not within my scope or expertise, understanding how it impacts what I am treating and being able to refer out. I think that's the biggest thing, is providers being able to say, I don't know, I think this sounds off, but that's not something that I can really treat. Who can we find who can help us make sure we don't miss that puzzle piece? Because sometimes a provider can be very well-meaning and treating within their scope, but they're missing a piece that may have a big impact. And so, yes, we want providers to only treat within their scope, but we want them to have a greater understanding of how to make sure not to miss any of those pieces and be able to pull in, like we talked about, that team approach and not functioning in isolation. Like no piece of the body functions in isolation. As providers, we shouldn't function in isolation either.
Yeah,
very true. I'm currently like temping in an office in a short term, and I'm trying to control myself when it comes to like the tongue tie stuff, not step on anyone's toes. But anytime that they're recommending night guards or someone has a night guard or something, I'm subtly talking about like, did you know your grinding has a lot to do with your breathing? So make sure you keep your nose nice and clear. And then step 2 would be keeping your tongue on the roof of your mouth, because I think so often we're just kind of like zoned in on our one specific thing. Is like, oh, I want to protect these teeth. Like I have good intentions. I want to give them a night guard, but there's more to it. So I think that's a good point of like understanding more so you can be more comprehensive.
Yeah. And also just bringing awareness. I can't tell you how many times I'm treating a baby and start asking the parents, how do you sleep? Who's the snorer in the family? And then it snowballs. I've got dad going, can you look at my tongue? And just that light bulb moment when the parents start being like, oh, is that why X, Y, and Z, struggle I've had my whole life? And I'm obviously not going to be doing anything treatment wise when it comes to the parents, but like just helping to bring awareness and just get them started thinking. And then they're like, oh, who should I go see? I've got, here's my list of adult providers. And that can be so powerful too, to just plant the seed. Sometimes they're not ready for it in the moment, but it gets them started thinking, and, who knows what that seed will turn into down the road. But like we said, it's never too late to address issues with oral function or your body asymmetries or tension or anything.
Yeah. It's funny because that's also why a lot of times, like my practice, I know Kimmy does too, kind of have family pricing, because I'm evaluating this 12-year-old who got referred to me, and all of a sudden, actually, this sounds like her sister. Wait a second, this sounds like her dad. Wait a second, this sounds like me too. All of a sudden, you have this family of 4, and they all need help. And I'm like, don't worry, we're not going to charge you per person, because like, you don't have to pick your favorite amongst the 4 of you, right? I tell parents all the time, I'm like, you don't have to pick your favorite kid. We'll see them all, and we won't make you, not be able to pay your mortgage, right? So and that's why, because it's, and like Kimmy said, I have 3 sisters, and we all had tongue tie issues. And if my parents knew about this in the early days and they needed to treat all 4 of us, like, it definitely would have been, pick who's the worst and then start from there, right?
And I still have families that do that too. Like I have a family of 5 right now that I'm seeing. Mom has like second worst tie, but she has no tension. I wonder if she's hyper flexible. She just doesn't really feel it. but we've worked on a lot of things. Her tone is stronger. We've corrected her tongue thrust. So her open bite is starting to close. So she's like, I don't need a release. I'm okay. And I can't force anyone. So I'm like, okay, well, if you change your mind, I got you. The oldest son, most severe, grade 4, very little range of motion. He's done a lot, but we need to do his release. The daughter, she has some restriction, but she's worked so much that like we've got rid of her headaches and she's like not having nightmares anymore. She's doing amazing. She decided that she doesn't want to go through a release. One of the other brothers, I think he probably should because he grinds teeth and he still has some of that low tone, low muscle, low posture. So I think long term he would probably be good. But they decided budget wise, they can only afford to do one. So they have chosen to do the oldest with the most severity, and you just meet people where they're at. You can't make anyone do a surgery they don't want to do.
Absolutely. I think it's so funny because talking about the family connections, we were with my 89-year-old grandmother yesterday, and she kept looking in my 6-year-old's mouth, and that's her great grandchild, and was like, what is in there? And she has top and bottom expanders right now. And I was like, oh, those are expanders. And she's like, what are they doing to her mouth? And, I explained it, and, she was having airway issues. She was having nightmares and mouth breathing at night and teeth grinding and all this stuff. Her tie is, we probably won't release. She's pretty good. We'll do Myo obviously after her expansion, but anyways, and explaining it to my 89-year-old grandmother. And she was like, oh yeah. Cause and you look in her mouth, she has the most narrow palate. And so I'm like, okay, here's where we can trace all this
the trajectory.
Cause I'm tied also. And my dad has had airway issues. And so it was all in one room and you could just see it, trickle all the way down. And she was like, that's really cool that you can do it, this early. And it's
versus wait and see with the ortho. And they're like 12 to 14 years old before you start doing anything. And usually they don't expand at that age. So Britta, talk to us a little bit. One of the other frustrations is like, okay, my baby is refluxy. They have like the open mouth posture. They have their release. They maybe did body work, maybe not, but the reflux and the spitting up is not improving. What can they do for those babies at that age?
Yeah. So the digestive issues can be such a big trigger for families because if it's a baby who's really uncomfortable from their reflux, that can affect literally every aspect of your life. I had that baby. It was my child. So I empathize with those families so much because it affects their sleep. They can't put them down. They're not getting their floor time. So now they're not getting movement. They're not doing tummy time because they spit up the whole time in tummy time. And it really can just kind of have this snowball effect on how the whole family functions, right? Everybody's like, nobody else knows how to hold my baby because they're just so uncomfortable. Like people who aren't baby people or parents, you hand them kind of a refluxy, colicky, kind of uncomfortable baby, and they don't know what to do because it's kind of difficult. They don't just kind of melt into your arms. And I've had parents come in and say, I can't even, leave them with a babysitter or have a family member hold them for me while I go take a shower or cook dinner or anything, because that baby's really trying to communicate that their body doesn't feel good. And what I always start with, this is my first kind of piece of all the evaluations I do with babies, is I take them through all the different motions that their bodies can do and find what does feel good. So I let their bodies kind of talk to me and show me what positions do feel good. And we start there. So I tell parents of babies who are struggling with that they are communicating discomfort, something still not functioning well, and our job is to first find how we can help them be comfortable in this moment right now.
Mm-hmm.
Right? With a goal of improving all this other stuff. Their oral function is not going to magically improve overnight, even after a release. So potentially they're still having issues with, tongue strength and suck and all of those things, which are going to take time to improve. What can we do in this moment right now to find some ways to help this baby be more comfortable? And that's where we start. And there's always positions that we can find that do feel good in their bodies. And just that permission, finding that spot, the magic little snuggle that they can do with their babies. And sometimes it looks like their baby is like a contortionist, like the position that we find that's their spot, their magic, comfortable position based on their tension patterns and what's going on in their body. When the parents find that and they're like, oh my gosh, like that, my baby finally relaxed or calmed down or stopped fussing, or sometimes we even have them hold the baby in that position to nurse. We find a specific position for them to feed in. This sense of relief of, oh my gosh, I don't have to force them into a position that feels bad to them. And I can listen to their body and what they need right now. And that's where we start. And allowing those babies to find those motions that feel good is so powerful for them that it helps improve their movement in other ways too. So that's what we find, is that instead of forcing babies to go into positions that don't feel good for them, we find the feel good positions. We let them stay in those positions as long as it feels good. And that's what actually helps release the tension in the other directions.
Because they can go out of fight or flight being tense and tight into parasympathetic, and then they can chillax.
Absolutely. So that's one piece of it. The other piece is that pulling constantly on tight muscles and fascia can stress those tissues more than it actually helps stretch them out. And so if we go into those positions of ease, we're actually putting all of those tissues on slack instead of pulling on them and creating more tension. So it actually can help release tight areas as opposed to kind of traditional stretching, which over time will finally work. It takes longer because it's stress. Right. So instead, when we find those positions of ease for the baby, what we're doing is we're putting any areas that are tight on slack. They're getting more blood flow. They're getting more lymph drainage. The fibers are actually able to go on slack and relax. And that's what can help release those areas of restriction.
My nephews were born, they were in, August. So right now they're 4 months old. But when they were a month and a half, I went and saw them. And, I had another nephew born a month later. They all were tongue-tied. They saw the exact same providers, the exact same lactation consultants. They did cranial sacral. They saw the exact same chiropractor. But my sister that didn't have the twins, he is a dream baby. He sleeps through the night. He doesn't really get much reflux. He's not super gassy. He's very chill. The twins, I think because of how cramped they were in the womb, they both have a lot of tension. And even with their tummy time and stuff, they're getting a couple little flat spots. And they don't sleep well because they're colicky. And it's really frustrating for my sister because her husband's on deployment and she's got 3 under 2 years old. It's a lot. And when I think of colicky babies, I think of this old coworker I had. He would complain about her first child, who's now an adult, but she's like, I like him now, but when he was a baby, I hated that kid. He was a little a-hole.
I was the colicky baby in my family of 4. I was the colicky baby in the bedwetter. And yeah, my dad to this day, it still tells me that, oh yeah, I used to carry, my parents would do the football hold for me. That's, my dad would have to hold me and bounce me around. And, that was of all the things they remember from my childhood, which you guys will laugh about this because of what I do. I was the, colicky baby who had to be held a certain way. And I refused to give my pacifier to Santa. I tried. Apparently I tried, and because I was going to trade my pacifier for Santa presents, and then decided it was not worth it to me. Bad trade. It was a bad trade. And as you guys have probably heard throughout, that's like the number one thing I'm working on with my own child right now is my little triple fister pacifier.
I know. This is Izzy.
At all times. Oh my gosh, it's so funny. And we're working on it, and I'm trying to transition her to a BB munchie, and but my mom will look at her sometimes, and she's like, she has your mouth. Like when you were little, I'm like, Mom, that's because of the pacifier. She's like, I know, but you're welcome.
Britta, so suck training, does that also help with the colic and the reflux to like help strengthen their muscles? Like what else can people do for that?
Yeah, I mean, again, we have to look big picture at, do we need some core strengthening to help, kind of just develop all the muscles in the body? Do we need to improve oral function? Do we need to get more vagus nerve stimulation from the tongue, get into that rest and digest so that we can help keep food moving through our digestive system, right? If they're not getting that stimulation from the tongue, if we're in constant fight or flight, also, if we're in constant fight or flight, it's affecting their respiratory patterns, the movement of their diaphragm, which that affects the pressures within the abdomen. The pelvic floor and the diaphragm are what create the pressures, the correct optimal pressures in the abdomen to be able to have good function of all of our abdominal organs. Oh my gosh, it's like we could go down so many rabbit holes here, but again,
we love rabbit holes.
What is that baby trying to communicate through their, colickiness, their fussiness, their reflux? And again, each baby probably has different puzzle pieces that we need to connect, but we need to be able to give parents support and resources through that, because it can be a very dark time if you're dealing with a baby who has colic, eating issues, sleep issues, because these babies, they have the trifecta, right? If they're struggling in one, most likely they're also struggling with one of the others too, and severely affects parents' mental health, the function of the whole family, and they absolutely deserve support from all angles of that. And so sometimes that means also mental health professional for parents, someone who can help with the sleep piece, again, pulling in all those different providers. But yeah, it can be a real struggle to go through with reflux or colic.
Yeah. And then, we start like throwing in, people talking about sleep training or, sleep coaching, whatever the non-offensive hot word for that is right now.
But these babies cannot be sleep trained.
No, because that's exactly where I was going.
Yeah.
That's exactly where I was going is, and because parents are so exhausted, like, oh, let's just get to the 5-month mark so we can just sleep train them. Right. And like, I completely understand that mindset, and 1000%. Thank God for Jenny June, who helped us so much with Isabel, as you guys know. But it's like, no, that you can't. You have to work on their feeding issues and their tension issues and their ties and everything else. Otherwise, we're not meeting their baby's needs, no matter which sleep training, co-sleeping, whatever method you prefer. You have to take care of those pieces first. Otherwise, nobody's going to be happy.
Yeah.
Exactly. And so I love that you brought up kind of bringing all those pieces in, and even just like the support for parents, right? Because we get kind of lost in the baby and everything we're doing for the baby, that like parents get lost. And even knowing everything I knew, I struggled with postpartum a lot, and I've worked with mental health professionals. Kimmy and I both have in our own spaces, and we're not we have no stigma around that. So I think that was such a good point to bring up about like, we're not always just treating the baby, like it's everybody involved. And I think that's so important. So, Britta, do you want to just join as our third podcast host? Because we just love having you.
I know. Thank you guys.
You can just be our spotlight, celebrity and guest. So remind our listeners, if they haven't had a chance to listen to the first episode yet, because they're going to go back when they are, but how can people find you? Where can they follow you? Give us your socials.
Sure. So my main place you can find me is on Instagram. I'm at Progress Through Play, and I treat locally in Denver. So you can find all my services on my website, which is ptpdenver.com. And then I do virtual consults. So
beautiful. And as you guys know, you can catch Kimmy and I on Instagram at the Munch Bunch podcast and on YouTube. And you can catch us individually, Kimmy at Mouth Muscle Memory and myself at NWMFT. Feel free to DM us your questions, you guys. Let us know if you have questions for Britta and you want to ask us as well. Feel free. Ask your questions. Don't be shy. We, as you can tell, we are here to help all of you. So thank you again, Britta. So great to see you. And we will chat with you soon.
All righty. Thanks, guys.